Alright, so we're going to start here where I left off this morning with physiologic changes in pregnancy. We're going to start here with the endocrine system. So hormones are essential to maintain the pregnancy, obviously. The most hormones are produced by the corpus luteum and later by what? Hopefully you guys will take some time out and actually research and look up these blanks, fill in the blanks, but of course I'm not going to stop, but I hope that you will pause the video and go and look and research these things, as you will learn a lot more than just me telling you the answers. The most hormones are produced by the corpus luteum and later by the placenta. All right, the biggest change to the endocrine system during pregnancy is the addition of the placenta as a temporary endocrine organ that produces large amounts of what? Estrogen and progesterone. Estrogen and progesterone that maintain the pregnancy, as well as HPL and HCG. So HCG, hopefully you guys recall what HCG was. That's human chorionic gonadotropin. And HPL is human placental lactogen. And you can find these on page 51 in your book. But be sure that you understand how this is working here. Bye. Well, there we go. Reproductive system changes. The uterus, the normal weight is 2 ounces. The pregnancy weight can be up to 2.2 pounds at term. Okay, so a significant increase there. The size is normal. Size is pear-shaped and behind the pelvis. With the pregnancy, it becomes globular-shaped and occupies most of the abdominal cavity. All right, anatomy, the decidua must be maintained. If you don't know what decidua is, look it up. The myometrium. If you don't know what the myometrium is, look that up as well. The myometrium must stay relaxed to prevent premature contractions. The walls become thinner with the expanding size of the uterus. In circulation, you have a dramatic increase in the blood flow to the uterus as the placenta and fetus develop. All right, continued uterine changes. The fact that we have growth and position of the uterus provides useful information about fetal growth. And this is what I was talking about earlier today, telling you we would get to it. And this is about fundal height. All right, so at 12 weeks, fundal height is the top of the uterus, and it's called the fundus. The top of the uterus is called the fundus. So at 12 weeks, the fundus is just above the symphysis pubis. Hopefully you guys recall, symphysis pubis is basically your pubic bone. At 20 to 22 weeks, it's right around the umbilicus. That's your belly button. At 36 to 38 weeks, it's up around, about 38 weeks, it's up around the xiphoid process up here. This is when it reaches its highest point. 38 weeks is when the fundus reaches its highest point. Now at 40 weeks, if we went through all this today, that 40 weeks is term delivery. So at 40 weeks, the fetus descends down, the baby, where's my mouth? The baby is actually descending, dropping down into the pelvis further, sometimes a little bit sooner. Therefore, our fundal height is dropping down some. All right, this is what's called lightening or engagement, when the fetal head moves down into the pelvis, when it becomes engaged down into the pelvic cavity. All right, more uterine changes. We've got Braxton Hicks contractions, which are irregular, painless contractions that occur during pregnancy. These are often called practice contractions. And I do think I did post something on Blackboard, or I'm pretty sure I did, on Braxton Hicks contractions, a little snippet from a friend's clip. They can occur starting in the second trimester. They are palpable. You can feel them. They are sporadic and irregular. The biggest difference is the fact that Braxton Hicks contractions do not cause cervical changes. Real contractions are going to cause your cervix to start dilating. Braxton Hicks contractions will not cause any cervical dilation. All right, they're also known as practice contractions. As your labor nears, these contractions become more regular and sometimes cause discomfort. All right, changes for the cervix. The cervix changes in color and consistency. This is where we get Chadwick's and Goodell's sign, which we've talked about today. The mucus plug forms a seal. The mucus plug, I All right, it forms a seal over the cervical canal to prevent microorganisms from entering the uterus. It acts almost as a barrier. Effacement occurs. That's the thinning and shortening of the cervix. Dilation is the actual opening of the cervix to allow for the passage of the fetus. And then cervical ripening is the softening of the cervix to allow for dilatation and effacement. All right, cervical ripening, if it usually occurs naturally, the body naturally does this. If it doesn't and we need to induce labor, we need to induce cervical ripening, we do that with medications or procedures such as called Cytotec, Cervidil, or a Foley bulb. Those are all mentioned in your book. Usually when I teach this in class, I draw my beautiful drawings on the board to explain the mucus plug, effacement, and dilatation a little bit better, dilation a little bit better. So if you have questions about these things, you're not understanding anything, just please be sure and ask. All right, changes for the breasts. The areola become deeply pigmented. Sebaceous glands become much more prominent. The hormone that initiates lactation, hopefully you guys will stop and look that up, what the hormone is that initiates lactation. That's called prolactin. We'll have colostrum, which occurs during the last few months of pregnancy. It is very high in, again, I hope that you will pause this and look these up, but it's very high in protein, fat-soluble vitamins, and minerals, and very low in calories, fat, and sugar. Colostrum will be like a thin, yellowish fluid. It's also known as liquid gold. They'll call it liquid gold. Okay, so colostrum, you don't get very much of it. Women don't produce a lot of colostrum. It's just a very little amount, but it is very high in nutrients for the babies. It's enough to feed the babies and satisfy them those first few days. How long does breast milk remain colostrum? It'll last for the first 2 to 3 days, after birth. And then the term for milk production is lactation. Changes to the breast, obviously, you hear people oftentimes saying, as soon as they get pregnant, and I think we discussed this on probable, or maybe it was presumptive signs of pregnancy, which was enlarged breasts. But increasing breast size, they'll start feeling more full with milk production. The areola become darker, which we talked about, and they will have much more visible veins to the breasts. Okay? Respiratory system changes. All right. In the respiratory system, the mom breathes more deeply to increase blank and blank exchange. Hopefully you know that that's going to be oxygen and carbon dioxide exchange. You increase oxygen consumption. The pregnant mother increases her oxygen consumption by 15% while she's pregnant. The pressure on the there's a lot of pressure on the diaphragm from the expanding uterus. Dyspnea, if you don't know what dyspnea is, look it up. Dyspnea may occur until lightening occurs, which we just talked about lightening, so if you don't remember what that is, go back a couple of slides. Okay, it's when the fetus descends into the pelvis, relieving that pressure on the diaphragm. Swelling of mucous membranes related to increased estrogen can cause nasal stuffiness, voice changes, and epistaxis. If you don't know epistaxis, look it up. Very common thing that happens, but epistaxis is the medical terminology for it. Okay? So a lot of people will get really stuffy and real congested with the pregnancy, and these are all normal changes related to estrogen, the increase in estrogen with pregnancy. You have an increased thoracic diameter related to the relaxation of the ligaments. Your lung capacity, however, remains the same. Inspiration and expiration increase for a greater oxygen intake, though. All right, cardiovascular system changes. Cardiovascular system, pregnancy can cause palpitations, arrhythmias, and systolic murmurs. Your blood volume increases, so we have hypervolemia. Your blood volume increases to how much percentage greater than your pre-pregnant state? by 32 to 34 weeks gestation. Again, I really hope that you guys will stop this and look it up. You'll learn it so much better. But I'm going to tell you that it's 45%. All right, your cardiac output increases. Your pulse increases by 10 to 15 beats per minute. Your basal metabolic rate increases by 20%. Your blood pressure does or does not increase. Okay? We talked about we're going to have this increased cardiac output, hypervolemia, but your blood pressure does not increase when you are pregnant. What is a normal blood pressure, or which blood pressure calls for attention? A blood pressure of 140/90 or greater is going to cause for medical attention. Supine hypotension syndrome is another thing that happens very frequently with pregnant women. It occurs when the pregnant woman lays on her back, and it occurs because of the baby, the weight of the baby when the mom is laying on her back, presses down and causes compression to the vena cava from the gravid uterus, so by the fetus. The fetus is causing pressure to the vena cava. Signs and symptoms of supine hypotension. The mom will start complaining of dizziness, feeling lightheaded, pale, clammy skin. So what are we going to do? We know what's causing it. It's caused by the mom laying on her back and the gravid uterus causing compression of the vena cava. So what are we going to recommend? Right? We're going to recommend, obviously, that the mom turn to her side, preferably the left side. All right, musculoskeletal changes. We've got lordosis, which we've talked about, I think, before in this class, or at least I know I've talked about it in 105 with you guys. But we'll have lordosis, the posture that pregnant women often have related to the shift in the center of gravity with the growing uterus. They get a waddling gait with that. Round ligaments, they support the uterus and stretch during pregnancy. Round ligament pain is the reason for a lot of complaints in pregnant women, especially in I'd say probably second trimester as the pregnancy is really growing significantly. Round ligament pain is a very common complaint. And then you have relaxation and softening, of the pelvic joints from what hormone? What hormone is allowing this relaxation and softening of the pelvic joints? The hormone is relaxin. Now, why do I really need relaxation and softening of the pelvic joints? Hopefully you're understanding that you're putting all this together and you're realizing that we have to cause this relaxation and softening to open the pelvis up more for the passage of the fetus. Right, GI changes. GI changes. Gastrointestinal. Nausea and vomiting is most common in the first trimester, although sometimes you're just so lucky, like I was, and had nausea and vomiting all the way through till the day I delivered with each pregnancy. Patalytism gravidarium. I'm sure I'm not saying that correctly, but I'm not sure how you say it. But anyway, basically it's excessive salivation with the pregnancy. Heartburn from a relaxation of the lower esophageal sphincter and delayed gastric emptying. So you hear a lot of pregnant women complaining of heartburn. We have altered metabolisms of carbohydrates, which increases insulin resistance. Altered fat metabolism, which facilitates growth and provides maternal storage for lactation. And remember that our stomach is pushed upward by that gravid uterus. All right, urinary changes. The urinary system excretes waste products for the mom and the baby. Not just the mom anymore. Now it's excreting for the mom and the baby. We have an increased GFR. Hoping that you guys recall, or know that GFR is glomerular filtration rate. If you don't know that now, you will be knowing it in health deviations, I know. Proteinuria. Proteinuria is more common in pregnancy. That's the spilling over of protein into the urine. Urinary stasis puts pregnant patients in particular, at risk for UTIs, urinary tract infections. So they always recommend that pregnant patients drink at least 8 glasses of water a day, minimum. Okay? That's to decrease the risk of UTIs and decrease the risk of preterm labor. Dehydration causes uterine irritability, and which can increase your risk of preterm labor. And then obviously we have urinary frequency, as that's what you see in the movies of pregnant women always having to go to the bathroom all the time. All right, integumentary changes. Integumentary is your skin changes. These are caused by the high levels of hormones. And these are the different ones we're going to look at. Spider nevi, the palms have some integumentary changes. We have lordosis, which we already discussed. Linea nigra, chloasma, and striae, or stretch marks. So spider nevi, I thought I had pictures on here, but I guess I didn't. Spider nevi are just small red elevations of the skin with lines that radiate from the center. The palms, pregnant patients, pregnant women, their palms will get a darker red color. Lordosis, which we already talked about. I guess that's really technically not an integumentary change. I'm not real sure why I have it under there. But that's where we have that sway back related to the weight of the growing fetus. Linea nigra is a darkened area on the abdomen, which runs from the umbilicus to the pubis. So if you can see right here, this is this woman's umbilicus, and here is the linea nigra running right down here to the pubis, this darkened area of her skin. Okay. Then we have striae or stretch marks, which are a pinkish purple color, caused by the weakening of the elastic tissue of the skin. I think there's some good pictures in your book. All right, nutrition for pregnancy and lactation. I thought this was a cute picture. I never got big enough with any of my pregnancies to do that, and I just always thought that would be fun, but I never was big enough to do that with either pregnancy, with any of my pregnancies. All right, let's see. Nutrition. Nutrition begins before conception, continues during pregnancy, and hopefully causes healthy dietary changes for a lifetime. We need to make sure we have adequate intake of the omega-3 fatty acids, the DHA. Avoid exceeding recommended dosages of vitamins and minerals. Excess vitamin C inhibits the use of vitamin B12 in the body. Iron is something that most women get prescribed. They get prescribed a prenatal vitamin and iron tablets to take with pregnancy. And that's because most of our iron needs when you're pregnant cannot be met by diet alone. And then postpartum, they will continue on prenatal vitamins and iron supplements to help with the blood loss from the pregnancy, from the delivery. All right, weight gain, your pre-pregnancy weight, whatever your pre-pregnancy weight is. For a single fetus, you have an increased weight gain. If there are multiple fetuses, for like twins plus, but if you are underweight, you should gain about 28 to 40 pounds. If your pre-pregnancy weight is normal weight, you gain 25 to 30 pounds. If your pre-pregnancy weight is overweight, you gain 11 to 25 pounds. And if your pre-pregnancy weight is obese, you only gain 11 to 15 pounds. I'm not going to ask you those numbers specifically, but I just want you to see the gist that I know in the past when I've done this lecture in class, which again I prefer to do, I get a lot of students who comment saying they easily gain 40 to 60 pounds, 80 pounds with the pregnancy with no complications. And you can do that, but it is not recommended. It's not the ideal weight gain. First trimester, you gain about 4.4 pounds. And second and third trimesters, 1 pound per week. You should have increase your consumption by approximately 300 kilocalories per day. And protein, calcium, iron, and folic acid are very important in the diet, which I think we've already discussed some today. All right, psychosocial adaptation to pregnancies on page 67. We've got physiologic changes, body image changes, body image disturbance. We are now going to see ourselves very differently. Emotional security, cultural expectations, support from our partner and family. Whether the pregnancy was planned or expected has a lot to do on our psychological changes. Finances. If you wait till you're financially ready to have a baby, you're never going to have a baby. And your level of maturity. All right, we've got 4 aspects of body image that you evaluate. And those are appearance, function, sensation, and mobility. So appearance, they may perceive themselves as fat. Encourage the patient that these feelings are normal. Some patients may feel very beautiful and very good while they're pregnant. The body functions differently during and after pregnancy. This is normal. Many new sensations on the body, for example, breast tenderness and breast enlargement. Mobility. You can have decreased mobility as the pregnancy continues and the abdomen grows. And you see these women who can't bend over and tie their shoes anymore. You know, that's something they would have never dreamed they would have needed help with. All right, maternal tasks for pregnancy. Seeking safe passage for herself and the fetus, obtaining health care, securing acceptance of herself as a mother and acceptance of the fetus, learning to give of the self to receive care, learning to give of self and receive care and concern of others, and committing herself to the child as she progresses through the pregnancy. All right, impact on the father. The father is impacted as well. We have the announcement phase, begins when the pregnancy is confirmed. The adjustment phase is when we have to revise financial plans, become involved in preparing for the baby. And the focus phase, when the active plans for participation in the birth and changes in the lifestyle start occurring. All right, on your own, be sure that you review these things in the book, page 69 through 70. Is just the impact of pregnancy on the adolescent mother, the older couple, the single mother, the single father, grandparents, and siblings. Okay? All right. Now, next Monday, I think I don't have you because it's a holiday. And then the Monday after that, I think we have our first exam. So if you have any questions, please be sure and let me know, okay? Try not to wait till the last minute. Study a little bit each day. So that you can let me know if you have any questions or concerns and we can get them answered for the whole class. All right.